Hi, my name is Beaubrun, and I'm a Board Certified Behavior Analyst with Brett DiNovi Associates. In this video, I'll be talking about behavior analytic approaches to feeding intervention. This video will cover BACB 6th edition task list areas F1 and F7. The prevalence of food selectivity is higher among children with autism spectrum disorder in relation to children with neurotypical development. According to the DSM-5, one of the criteria for autism spectrum disorder is restricted repetitive patterns of behavior, interests, or activities, which may also include eating the same foods. Food selectivity, sometimes referred to as picky eating, is when someone eats a limited variety of foods. It can include avoiding certain foods, preferring certain foods, or rejecting entire food groups. Food selectivity may also be eating foods of a specific texture, temperature, or even brand. Professionals who address feeding concerns include but are not limited to speech-language pathologists, occupational therapists, feeding specialists, and nutritionists. Behavior analytic-based interventions commonly used to address feeding concerns may include modeling, high-probability instructional sequence, simultaneous presentation combined with stimulus feeding, differential reinforcement and shaping, specific avoidant restrictive food intake disorder interventions, and my favorite, using a chaser. In the article, Behavior Analytic Feeding Interventions, Current State of the Literature, there is a table that outlines feeding problems, which includes food selectivity, chewing, packing, food refusal, tune weaning dependent on gastronomy tube feeds, as well as recent advances in the literature, and suggestions for clinicians. Behavior analysts should use this resource as a guide when selecting appropriate interventions. Before beginning any feeding-based treatment, I would recommend clinicians gather baseline information before developing and implementing an intervention. I use a food questionnaire that asks questions to determine what the client typically eats in a day, if there's any health concerns or pre-existing medical diagnoses, including allergies and food intolerances that may impact feeding, and how the client is currently consuming their meals. Be sure to collaborate with related service providers, families, and professionals when gathering information and determining if a behavior analytic approach would be appropriate to address the feeding concern. Please subscribe to our YouTube channel and to disseminate the science, share this video.